The upper limbs possess three regions. The arm or the brachium is the region between the shoulder and the elbow. The forearm or the antebrachium is the region between the elbow and the wrist. And the hand describes the region that begins at the wrist and is everything that is distal from the wrist. So that includes the wrist to the tips of the fingers. The humerus is the bone of the arm, which is located between the shoulder joint and the elbow joint. The head of the humerus forms the shoulder joint with the glenoid cavity of the scapula. At the distal end of the humerus are structures called the trochlea and the capitulum. The trochlea, which is medially located, forms the elbow joint with the ulna. The capitulum, which is laterally located, forms part of the elbow joint with the radius. The medial epicondyle is a bony projection that is proximal to the trochlea, while the lateral epicondyle is a similar looking bony projection, except it is proximal to the capitulum. Both of the epicondyles serve as sites of muscle attachment for muscles that cross the elbow joints. On the posterior distal side, we find the olecranon fossa, which receives the olecranon process of the ulna when the forearm is fully extended. Figure 8.5 more closely examines the various structures of the anterior and posterior sides of the humerus. The head of the humerus is located at its proximal end. It forms the shoulder joint with the scapula. At the distal end are the capitulum on the lateral side and the trochlea on the medial side. The medial epicondyle is located just a short distance from the trochlea, while the lateral epicondyle is located a short distance from the capitulum. The forearm or the antebrachium consists of two parallel bones. The radius is the lateral bone of the forearm. The head of the radius forms part of the elbow joint with the capitulum of the humerus. The radial tuberosity is an enlarged, roughened region that is just distal to the head of the radius, and it functions as a site of muscle attachment for muscles that cross the elbow joint. The styloid process of the radius, which is found at its distalmost end, serves as an attachment site for ligaments that support the lateral side of the wrist. The ulna is the medial bone of the forearm. It possesses the trochlear notch at its proximal end, which forms the elbow joint or part of the elbow joint with the trochlea of the humerus. The styloid process of the ulna, which is found at its distal end, serves as an attachment site for ligaments that support the medial side of the wrist. Figure 8.6 describes the features of both the radius and the ulna. Towards the proximal end of the radius, we see the head of the radius, which articulates with the capitulum of the humerus and forms part of the elbow joint. We also see the radial tuberosity, which is a short distance away. At its distal end, the styloid process of the radius functions to bind ligaments that support the lateral wrist. The ulna possesses the olecranon process, which we can palpate or feel through the skin as the bony structure of the elbow. The indentation that's located on the anterior side, which is called the trochlear notch, forms the hinge-like joint with the trochlea of the humerus. So the radius and the ulna together form various parts of the elbow joint. The ulna also possesses a styloid process at its distal end to function as a site of ligament attachment and support for the wrist.